Hello, my name is Jeff Okeson. I'm professor and director of the Orofacial Pain Program at the University of Kentucky. We're in Lexington, Kentucky, USA. And I just want to let you know that I'll be coming to Cairo, Egypt to do a program on October 18th, 2016. And the program is going to be centered around what every dentist needs to know about TM disorders. And I think this is a subject matter that should affect you and many of your patients. Because if you take a look at some of the literature, what we find, here's a study that showed that in the last 12 months, 1 out of 6 patients that came to dental offices were there because of pain. Of course, the predominant pain was toothache, but the second most common was musculoskeletal pain, TM disorders. And we dentists need to be able to address those conditions because no other healthcare provider does. And what I'll be sharing with you is some information on October 18th about how to manage some of these TM disorders, because they will be in your practice, very common in your practice, and we can't ignore that. We have an obligation to help our patients with some of these pain conditions. And we're going to talk about this and how maybe occlusion fits. Most dentists realize that occlusion is important to maintain a nice functional masticatory system. Occlusion in a position which is most favorable for the joints, what I call orthopedic stability. So I'll be describing to you orthopedic stability in the masticatory system and treatment goals that you have as dentists to make sure the occlusion is going to work in harmony with the patient's function. Another thing we're going to talk about, though, is a question: is occlusion important in TMD? You see, that's another question, because occlusion may have a factor in some TMD and may not in others. And so we're going to talk about the variety of things that go on in our patients and what areas have to do with occlusion. Because if the patient truly has an occlusion problem, then we dentists are sitting in a situation where we can help those patients, and we need to help those patients, because changing that occlusion would all of a sudden take away those TM disorders. But on the other hand, this is a little more complicated, and there are some patients who have TM disorders with no occlusion issues. And if that's the case and we treat the occlusion, it gets pretty frustrating to us because we don't get the patient well, and we fail to be successful, and that's frustrating. So what I'm going to share with you is information on what are the patients that you can manage with changing occlusion versus the ones that you can't, and then give you some insight as to how you might manage them even if it's not occlusion. Because TM disorders is a musculoskeletal pain of the masticatory system. I'm going to share with you information about that, but it's a variety of things. Here are 5 different categories of TM disorders, and we need to know which one the patient has because because the management is going to be different. We're going to talk about all those. We're going to talk about intracapsular issues, the normal functioning of this jaw joint, and we're also going to talk about what goes on when this joint's not functioning so well: clicking, popping, locking, pain in the joint. These are the true TM joint disorders, and we're going to talk about some of those conditions. And so what we'll talk about how about the occlusal appliance, the most common thing that we dentists will do for patients. And I'm going to share with you when appliances are indicated, when they may not be indicated, and when they work, what do you do next? So I invite you to come and join me. It's October 18th. This is information on where the meeting will be there in Cairo. It's going to be a program, a pre-conference program to the second international program that they're having there. So I'm going to leave this on here so you can get some information and to contact people. I hope I have a chance to see you on October 18th in Cairo.